why is shoulder pain so difficult to diagnose and treat the cause of? The reason for that is that it's a very complex joint and it's an inherently unstable ball and socket joint. It's a ball and socket joint, but the socket is very shallow and the ball is too big for the socket. What you have to support that is you have lots of small muscles in the rotator cuff and other shoulder stabilizers, and you also have the shoulder labrum, a small membrane around the rim of the socket, which keeps it in place. Now, the problem is all of those things can get damaged to some degree. And in most cases where people have chronic shoulder pain, there's some degree of damage to all and any of these structures. So trying to localize which is causing the pain and then treat it can be quite difficult. It involves a thorough examination with your local doctor or shoulder surgeon, a review of all the images that you've had, including x-rays, ultrasound, and CT. MRI is very useful for soft tissue structures like the rotator cuff and the labrum. Once you've established what the most likely causes are, and I say causes because there are often multiple, then you work through them sequentially and you treat one and you see if it makes it better. Usually you'll get some degree of effect, and if there are other causes, then you have to work your way down those. Things that are a little unrecognized and sometimes more difficult to treat using interventional radiology techniques would be shoulder labral tears, often seen well on MRI. In the case where there are acute tears and causing significant pain, it's very worthwhile seeking a surgical opinion to see whether they can fix that problem for you.